It's been proven over and over again. There's plenty of studies at this point that have absolutely proven the validity and reliability of ultrasound guidance as the best way to make sure you're in the right spot you want to go in. My name is Alan Hirahara. I'm an orthopedic surgeon in Sacramento, California. I have been in private practice for 20 years. I'm a specialist in sports medicine as well as in shoulder and knee arthroscopy. I've also become an expert in ultrasound usage, not just in my clinic, but also in surgery. I've also become an expert in orthobiologics. And I've been a team physician for Sac State for the last 20 years, as well as the Sacramento River Cats, the AAA affiliate to the San Francisco Giants for the last 20 years as well. So I started using ultrasound in 2009. I had just come back from a meeting on orthobiologics in Munich, Germany, and I realized at the time that the Europeans and the Asians were absolutely outstripping us in their usage of orthobiologics. And the reason why they could is that they actually didn't have as much access to MRIs and they had to use ultrasound. But it turns out that it was actually a boon for them and something that we needed to do. And I realized that you couldn't bring a needle into an MRI machine, but yet you could use a needle to be able to specifically place your biologics into specific pathologies with ultrasound in real time. So I came back and within 3 weeks had a machine in my hands and getting very dangerous with it, and it was incredible. It opened my eyes completely. It's amazing because when I first started, I thought I was really good. And of course, I'm a surgeon, so I'm really good. But it turns out I wasn't. And the reason why I learned that is because, and it should have made sense to me before, if you're giving an injection into a joint, into a space, like the subacromial space, there shouldn't be any pain because it's a potential space. There's nothing that you're injecting to, there's no nerve to feel it. And so why should all these injections be so painful? Well, the obvious answer is I was missing. And it turned out once I started using ultrasound, it could be point specific, none of my patients had pain, unless I intentionally put it into a structure that I wanted to go into intentionally. I think it's absolutely coming. As an orthopedic surgeon, unfortunately I think surgeons are biased and they think that they can do a lot because that's the way they were trained to do things blindly, or they know where things are, how to get there, and it turns out you just don't. And what surprises me is we use fluoroscopy a lot in our world, and arthroscopy, which is my specialty. So why wouldn't ultrasound, yet another tool in our hands, be just as useful and good? And it is. And it's something that they should be using. And what's great is it is coming. It really is. And I'm seeing a change in the training, in residencies, in fellowships, and people coming out. The newer generations are absolutely being acquainted with it, taught it, and it will eventually become the standard of care, which it should be. If you're doing things like cortisone, which honestly, if you put it into a structure like a tendon or a muscle or a ligament or fat, you get necrosis. It damages the tissue. It's not good for the tissue. Even going peri-structure, is still not ideal, but still acceptable. So going into a structure is going to do harm to it. And then if you're going to do orthobiologics, where at this point today, a lot of the orthobiologics are not necessarily covered on insurances, and so these people are paying cash. You want to make sure you do the best possible for them to maximize their use of their money to pay you to do an orthobiologic. So if you're going to do that, you better get it in the right spot for the right reason. And so all the more reason you need to do ultrasound. The Clarius is outstanding. I was first introduced to this, many years ago prior to their launch, even with the first version. And I was blown away at the fact that it was wireless, the fact that it was handheld. And sure, the version 1 was larger, but that was the prototype, it was the first one. It's now absolutely handheld, usable, pocket-sized practically. For me, being able to bring it into the operating room and pop it into a bag that's sterile is so much better than having a cord that could be prone then to be contaminating the area. And now you have to have that that monitor so close to you because you're tethered by a cord. Now you can be wireless, be as far across the room as you want to be on a big screen, doesn't matter what kind of screen you use. And then of course, as a sports specialist covering events and games, being on-field point of care, that's literally the definition of point of care. So I can be there on the field, pull it out of my pocket, and just use my phone or my iPad to do a quick scan on someone instantly. That is outstanding. The image quality, in my opinion, is higher. Yes, in some instances, this unit is more expensive, but to me, if you compare the quality and the value you're getting, you're paying for image, as someone once told me. That value is incredible. So it's worth the extra small amount of money you're paying compared to some of the other handhelds that are marketed out there today. So to me, it's absolutely worth the value. And every time I show it to someone to compare, there's no doubt it excels and beats the others.